The American Association of Blood Banks embarking on a study to see whether a mysterious AIDS-like illness can be passed on through blood transfusions. Craig Heaps reports.
When word came out of the International AIDS Conference this summer in Amsterdam, many considered it a bombshell. A small number of patients were showing signs of AIDS without testing positive for HIV, the virus that causes most AIDS cases. The Federal Centers for Disease Control and Prevention calls their condition Idiopathic CD4 T Lymphocytopenia, or ICL. ICL refers to a critically low level of infection-fighting cells, a condition the same as in AIDS patients. What health officials don't know is what causes ICL. At its annual meeting in San Francisco, the American Association of Blood Banks announced it will study ICL and try to figure out if it needs to take any action.
If it is transmitted by blood, that we screen it out of the blood supply as soon as possible. There is no evidence thus far that it is, in fact, a disease that can be transmitted by blood.
Along with the CDC and the Food and Drug Administration, the American Association of Blood Banks will monitor donations at 10 centers around the country. They will then analyze 10,000 samples of donated blood. Using a machine called a flow cytometer, researchers will determine how many show low levels in infection-fighting cells without being positive for HIV or some disease that suppresses the immune system. When they are done, they will have a better picture of how widespread ICL might be, and if it is a blood-borne disease.
We know a lot now, and what we know now has influenced us and also the CDC and the FDA not to issue any urgent need to do anything specific about the blood supply.
Researchers hope to start gathering data as early as January, and they expect that by the middle of next year they'll know whether they need to screen the nation's blood supply on a regular basis for ICL. Craig Heaps for CNN, San Francisco.